Viruses are simply excretions of a toxic cell.
That's Thomas Cowan, an American holistic doctor.
They bud out from the cell. They happen when the cell is poisoned. They are not the cause of anything.
In this video that's been shared thousands of times around the world in 5 different languages, Cowan claims a virus isn't behind the pandemic. 5G wireless networks are.
Anybody want to make one guess as to where the first completely blanketed 5G city in the world was? WUHAN. Exactly.
That's not true. Some U.S. cities and South Korea had 5G networks long before Wuhan.
Notice the wordplay. Some cities had 5G. That's true. But China was the first to bring out a mass, large-scale trial of 5G. And one of the first cities was Wuhan. Facts.
Kindrachuk says scientists have sequenced COVID-19. They've taken it apart and put it back together again. They've infected primates with it who then exhibited symptoms.
I think the data is so overwhelmingly valid and validated to show that the viruses cause disease. It's almost difficult for me to argue why.
As New York City appears to be about 10 days ahead of the country, I feel compelled to get this information out. COVID-19 lung disease, as far as I can see, is not a pneumonia and should not be treated as one. Rather, it appears as if some kind of viral-induced disease, most resembling high-altitude sickness. It is as if tens of thousands of my fellow New Yorkers are on a plane at 30,000 feet and the cabin pressure is slowly being let out. These patients are slowly being starved of oxygen. I have seen patients dependent on oxygen take off their oxygen and quickly progress through a state of anxiety and emotional distress and eventually get blue in the face. And while they look like patients absolutely on the brink of death, they do not look like patients dying of pneumonia. I have never been a mountain climber, and I do not know the conditions at base camp below the highest peaks in the world. But I suspect that the patients I'm seeing in front of me look most like as if a person was dropped off on the top of Mount Everest without time to acclimate. I don't know the final answer of this disease, but I'm quite sure that a ventilator is not it. That is not to say that we don't need ventilators. We absolutely need them. They are the only way at this time that we're able to give a little more oxygen to patients who need it. But when we treat people with ARDS, we typically use ventilators to treat what's called respiratory failure. That is, we use the ventilator to do the work that the patient's muscles can no longer do because they're too tired to do it. These patients' muscles work fine. I fear that if we are using a false paradigm to treat a new disease, that the method that we program the ventilator, one based on a notion of respiratory failure as opposed to oxygen failure, that this method, and there are a great many number of methods we can use with the ventilator, but this method being widely adopted at this very moment in every hospital in the country, which aims to increase pressure on the lungs in order to open them up, is actually doing more harm than good. And that the pressure we are providing to lungs, we may be providing to lungs that cannot stand it, that cannot take it, and that the ARDS that we are seeing, that the whole world is seeing, may be nothing more than lung injury caused by the ventilator.
Thomas Cowan, he's currently on probation with the California State Medical Board and operating with restrictions on his practice after a 2017 complaint about another matter. Cowan has authored a book that argues against vaccinating children. He did not respond to CBC News' request for comment about the video.
I urge you to speak up. We can change this. I thank you all for listening. Please spread the message and stay safe.